LASIK is a procedure that started in the early 1990s, and this procedure consists of making a flap of the cornea with a mechanical device called a microkeratome that would actually, with a blade, cut the cornea, slice the cornea. We would lift this flap and later on apply laser to change the curvature of that cornea and then replace that flap. The procedure would usually take about 5 minutes per eye. Rehabilitation of vision is almost immediate, and the downtime in regards to seeing blurry or having foreign body sensation would usually take about between 2 to 4 hours. Later on, as the lasers improved, there was bladeless LASIK. Bladeless LASIK is a big advancement in regards to LASIK. In this case, the flap is made with a special laser called a femtosecond laser, and it's much safer than with the blade. And in regards to recovery time, and it's basically the same thing. Within a couple of hours, the patient usually is capable of seeing 20/40 or better, and within 4 hours, very close to 20/20 or better. Usually, patients that have nearsightedness, farsightedness, or astigmatism are a very good candidate for LASIK, either a regular LASIK with a blade or bladeless LASIK. Routinely, we expect this patient to have under 8 diopters. That's the ideal patient. And we're capable of correcting both astigmatism and nearsightedness or farsightedness at the same time. So patients that are not a good candidate for LASIK are patients that have an added disease on the eye. If the eye is not normal, or if the eye has an infection or certain dystrophies or degenerations of the cornea, then those patients are not a good candidate. Also, patients that have dry eye are not good candidates for LASIK. LASIK is painless, especially when it's done with the femtosecond laser. With the bladeless LASIK is totally painless. You never lose sight of your vision. With regular LASIK, there's a few seconds where you lose vision, everything turns black. But with bladeless LASIK, you always have very good vision. It's totally painless, and it takes about 5 minutes per eye. Nowadays, LASIK is very accurate in regards to correcting the full prescription. As technology gets better, as our lasers get better, they get very exact in regards to the amount of correction. So usually most patients have 20/20 vision after LASIK. Since LASIK, there is a flap involved, most of the complications that LASIK has have to do with the flap. If the flap moves, if the flap wrinkles, if the flap gets dislodged at any certain point after the procedure, this can definitely hurt your vision at that moment. It's very important to not rub your eye. It's very important not to go swimming or hurt your eye in any way, because that would eventually dislodge that flap. So around maybe the first 48 hours, try to wear eye protection. A pair of good sunglasses should be enough. Avoid rubbing your eyes, and wash your hands thoroughly before applying any eye drops. The procedure is very straightforward. It's painless. So the idea of having a patient move or having him blink, it really doesn't occur. We have special instruments that hold the eye open that are painless, and the laser nowadays have a special tracking system that follows your eye in case there's any sudden movement of your eye. It also, if for any reason the eye moves a lot, then automatically the laser shuts off and prevents more application of the, as soon as the eye is back to the neutral position, then the laser treatment continues just where it left off. So it's very safe. So routinely, after LASIK, I always like to see my patients after a few hours, or if the case permits, even the following day. After that visit, we make sure that the flap is in place, that the flap hasn't moved, that there's nothing in the interface of that flap. Obviously, that the vision is up to speed to what we were planning on achieving with the procedure. So after that, your regular eye doctor back home can do all the rest of the follow-ups, and that would routinely be after a month of the procedure, just making sure that everything still is in place, and that usually is. After LASIK, it is recommended to wait between 24 to 48 hours before returning back to your normal activities. Reason being, we don't want that flap to move at any way or get wrinkled if there is something that's going on, like rubbing your eye or hitting your eye, or so just take care. We don't want any infections also. So if you're on if you're taking care of those eyes, definitely that LASIK procedure will last you a lifetime. Usually we recommend waiting a week before starting to using makeup, and it's not necessarily the application of the makeup, but routinely it's when you remove the makeup that you rub your eyes maybe a little bit harder. So we try to avoid that, any eye rubbing for a week. The best thing about these types of procedure, specifically about LASIK, is that the tissue that's being evaporated with the excimer laser, that never regrows. How long does the effect of LASIK lasts? Once we do the evaporation of the corneal stroma, the tissue, that never regrows, that never grows back. So as a consequence, the correction that we make is permanent. Of course, the eye is still alive, and the eye can have changes. You can have changes in regards to your prescription as you grow older. For example, around 40 years of age or past 40 years of age, any normal person is going to need reading eyeglasses. So it's going to happen the same thing with if you have LASIK. If you have LASIK, as soon as you start getting between 40 and 50 years of age, you're going to need some reading eyeglasses. But it's not because LASIK stopped working, but rather because your eye is getting older and it's having those natural changes. If you start depending on eyeglasses, in this case for reading, then there's always a procedure that we can do next to improve your vision, even after LASIK. There's depending on what is needed or how your eye changed. Your vision, your eye can change because of cataracts, can change because of any other disease. So routinely we can correct those type of problems, and then the problem is gone. With the early lasers, there were certain halos and night vision problems. Now, most of the patients that are nearsighted have problems seeing at night anyway. Side effects like glare and halos around lights may be more common, and it was more common with the early lasers. Now with the newer lasers, this type of halos and this type of glare does reduce compared to before. We know for a fact that after LASIK, your vision will always improve, and you will always see better after LASIK. Sometimes you might need an enhancement. No, it's not the routine that we have to do enhancements after the first procedure, but there are some cases that can be improved with an enhancement of Lasik in case it's needed. Yes, all patients are seeing 20/40 or better after Lasik. I would say maybe statistically 90% of our patients see 20/25 or better, and I would say maybe 98% of our patients see 20/20 or better after Lasik. We are not doing Lasik, or we're not doing one procedure to everybody. We have different procedures, different type of lasers that work differently to correct the specific defect or the specific problem that you might have. So maybe you're not a good candidate for Lasik, but you're a good candidate for Smile, or you're a very good candidate, you're a better candidate for an intraocular lens. All these options, and we have many options in regards to correcting your vision with the surgery here at the Institute. So why is our place better? I think that we try to give the best procedure for each patient as opposed to having only one recipe for everybody.
Medical Tourism Corporation facilitates affordable medical and dental treatment at world-class international hospitals and clinics. Fill out the estimate request form on our site, medicaltourismco.com, for a free quote and more information.